Okay, good morning, good evening, good afternoon, doctors, nurses, and pharmacists. I'm DrChe, and today we will discuss some important reading tips, part A and part B, and some tips for part C. So if you can hear me, just let me know. Can you hear me?
Yes, sir.
Okay, so we're going to start very soon. Just let me share the session with the doctors and nurses, and then we will start. Just 1 minute, then we will start. These are my own samples, so you will not have done these samples before. So anyone can just resume for us. Uh, what is the approach for reading part A? Anybody can just give. Can you hear me? Anyone can just quickly unmute and tell us the tips for reading part A, how we approach, how quickly we can do. No one wants to participate? Can you hear me? Can anybody hear me?
Yes, sir.
Okay. Can you just give what is the approach for reading part A? Just what you know, how we approach for reading part A. Okay, it's very easy. Reading part A is key to success. Means if you get 19 out of 20 or 20 out of 20 in reading part A, then you can easily pass your reading module. You can get B easily. But if you mess up in reading part A, then it becomes very difficult for you to pass because reading part is very easy. The only important thing is the time management. So time management is important in reading part A. So if you are able to do all the questions in 20 minutes, then it is very easy for you to get 19 out of 20 or 20 out of 20 in reading part A. So first we do skimming and scanning. Okay, I will show you my sample. Just I am sharing the session with other doctors, and then we will start. Just 1 minute. Just 1 minute. I am going to start very soon. Okay, can you see my screen now? The word file here on my screen. Please try to participate. Can you see my
Yes,
screen?
sir.
Okay,
Yes,
Dr.
sir.
Nadeem is there, Dr. Manish is there.
Yes, sir.
So some people, I already, Dr. Upol, we can't hear you. You can join again. Okay, so Dr. Nadeem, as you already know a little bit, so what is the approach for reading part A? Just quickly, please, in 1 minute.
Sir, we spent around 1 minute in
Mm-hmm,
reading the text,
mm-hmm,
and what we do in this 1 minute is just quickly scan and skim and scan the whole text.
mm-hmm. Yes, so that is true. So in the first 1 to 2 minutes, 1 minute, 1.5 minutes, we quickly skim and scan the text. What is included in the text, headings, subheadings, okay, and the paragraphs, what is written there quickly. So let us do this quickly. So this is reading part A. This is my own sample. And that if you see here, the topic is lumbar puncture. Lumbar puncture, okay. So in text A, mostly they write general information about lumbar puncture. So we can just quickly read. This is also known as spinal tap, procedure, CSFS fluid. The main reason of this means they are giving the reason, okay? The main reason, examples. So you don't need to read the complete text, okay? So this is what is lumbar puncture, the reason for this, the examples. Here you can see the word contraindication. Dr. Nadeem, Dr.
Yes, sir.
Manish, Dr. Manish, you can hear me?
Yes, sir.
Okay, so here you can see the word contraindication. So they would be talking about contraindications in this part. Then in this part, they are talking about how to manage the side effects. Okay, so back pain, numbness. Okay, Tylenol. This is the name of medication. If you have a headache, what you need to do? Caffeine. Okay, and sometimes headache persist for a long time. Then you can do what? Okay, so now you have done skimming and scanning of part A. Okay, text A. So can anybody just quickly resume what is included in the text A? Dr. Nadeem.
Sir, just a simple definition and
Yes.
example.
What is lumbar puncture? Examples. The reason
And
means indication. Okay.
yes, sir.
Examples here and here.
And contraindication
Contraindication,
And then
and side effects
side
management.
effects.
side effects management of side effects. Okay. Managing side effects. That is good. Okay. Now we have text B. This is text B. You can see this is not actually a text. This is a table. Okay. So we need to read the heading of table, lumbar puncture interpretation. So this is the heading. Then it becomes very difficult. We cannot read the complete table in 1.5 minutes. Okay. So what we can do? Can anybody just give an idea how I can get overall idea what is included in the table? Anybody wants to participate? Anybody wants to participate?
Sir, we just read the headings. I mean, the like condition, pressure,
Yeah.
WBC. I mean, these headings.
Yes. So these headings of columns and of lines also. Okay. So these are lines, these
Yes,
are
sir.
columns. So this is a condition: bacterial, viral, Lyme, TB, fungal, cryptococcal, epidural brain abscess. Okay. So these are the conditions. And then there would be tests. Okay. Pressure, WBC, prominent cell type, glucose, protein. Okay. Further CSF testing. So if you say pressure is everything is written with pressure, and the thing where they are writing more information is further CSF testing. Okay, there must be some questions from this column. Okay, I have written this example. but a long time ago, I don't know how many questions are there, but there must be questions from this column. And what we call this last, when we write something at the end of table, what we call it? Footnotes. Footnotes. Okay. These footnotes are always important whenever you are doing reading exam. These footnotes are very important. Okay, most of the times. Okay. So here I think is not important because there's nothing important. Okay. So now then we have text C. So let me just make it a little bit small. So what is included in text C?
Most common complications of the lumbar puncture.
Yes, post LP headache. They're just talking about post lumbar puncture headache. So if they're talking about when it lasts for 2 to 8 days, 40% in patients, so you don't need to read the complete, okay? There would be diplopia, hair loss associated with that. Diagnosis clinical. This is the prevention. You can do these things for prevention. And this is the treatment of post lumbar puncture headache, pain relief. Okay, this review. So all of these things. So just you can get easily an overview. Now, text D. Can anybody tell me how you can get an overall idea about text D? Text D. So these are the future developments for lumbar puncture. Future developments. First of all, they're talking about historically. Historically, people used to use lumbar puncture, but recently this is critically of underuse, especially in suspected meningitis. So skill development and training doctors, they could be used for maintaining or revalidating skills. Fluoroscopically guided lumbar puncture is an option. So this is future development. Fluoroscopically guided lumbar puncture is standard lumbar puncture has been unsuccessful, but due to X-ray exposure, they are not suitable for pregnant women. Okay, they're just talking what we can do in future. They likely that ultrasound guidance will become a routine part of lumbar puncture in future. So just talking about what we can do in future about lumbar puncture, what developments we can make, what was successful, what was unsuccessful. So you got an overview of all the texts A, B, C, and D. Now it is time to go for questions. So in reading part A, always first quickly skim and scan the texts and then go for questions. So there are two methods that people adopt for reading part A. Some people, for them is easy to use first, solve first 7 questions. Okay, they start from 1, 2, 3, 4, 5, 6, 7, 8, and then 9. Okay, like this. But some people find it easy. They do fill in the blanks first. It means question number 8, 9, 10, these first. And then they do this part, last part. And then at the end, they come to this part where you need to find in which text you can find the information. Can anybody tell me why they do this? Can anybody mention why they do this?
Sir, because they want to get an idea. I mean, about the text. That's
Yes.
why.
Yes. So when you are solving these questions, question number 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, when you will solve almost 13 questions, 13, 14 questions, then unintentionally, just by solving them, you can easily get a little bit more deeper overview of each text where you can find the information. So once you do this, then it is very easy for you in which text you can find which information. Then it becomes easy for you. Okay. So I am not saying which method is good. I am not saying which method is good. You can try both. You can try both. Okay. You can try both and find which one is better for you, which suits you better. Try both and try which one is better for some people. Just sequence wise is good, 1 2 3 like this. For some people is good to start with question number 8 9 10. For me, when I got my exam more than 3 years ago, for me it was easy to start with question number 8 9 10, but it depends upon you. So try both of them and find which one easier for you. Okay, so now let us do question number 1. Okay, so the question is, just you need to tell in which text you can find the information. Those people who are watching us on Facebook, write in the chat, okay, which text is possible. And those who are on Zoom with me, they can also write in the chat where you can find the answer. Please don't answer directly until I ask someone to do so. A new method of doing lumbar puncture if classical method fails. In which text you can find this answer? Please write in the chat in which text you can find this answer to this question. In which text you can find? Just try. Okay, write in the chat, please. So only one, Dr. Nadeem, and okay. Let us see on Facebook what people say on Facebook. So most of you are saying the question, the answer is D. Okay. So Dr. Manish,
Yes, sir.
can you hear me?
Yes, sir.
So why your answer is D? Let us go to text D. So you will find there a new method of doing lumbar puncture if classical method fails. So how you can justify that your answer is in text D?
It's compared to other topics of the ABC, there is a topic like the future deployments. Maybe it means like the any new coming ideas or overall related, all are fine in the D. That's why I hope so.
Yes, that is just guess. Okay, this is your
Yeah.
guess.
Yes, sir.
But you need to verify your answer. You need to verify your answer. Okay. If let us consider as fill in the blank. If it is fill in the blank, then what we will write?
Mm,
Okay, so let us just use the keywords.
okay.
Okay. So keywords here are a new method. Okay.
Yes,
If classical method fails. Okay. A new method if classical method fails. So I can use synonyms for classical method. I can use synonyms for new method. Okay. So stress used to be critical for unthinking use of lumbar puncture, but more recently use of underuse, especially meningitis, profound by practitioners. Okay, so nothing is mentioned in paragraph 1 is an option if a standard lumbar puncture has been unsuccessful. So your answer is here.
Yeah.
If it is fill in the blank, what you will write?
guided
If it is fill in the
fluoroscopically guided
blank,
lumbar puncture.
yes, if it is fill in the blank, we will write fluoroscopically guided lumbar puncture. Okay, or only fluoroscopically guided, okay, LP or just like this, okay. So just when you do reading, mostly people, you keep failing in reading part, in reading module. The reason is because you don't do, critical analysis when you are just, doing practice. You are not doing critical analysis of your mistakes, how you attempt the questions, how you find the answer. No, by guess it is easy. It could be in reading part in text D by guess, okay. But we need to find the answer there. Just quickly verify if the answer is there or not. Maybe the answer is not there. It looks like the answer is there, but maybe it is not here. It is in other text. So you need to verify the keywords and find the answer keywords there, okay. So fluoroscopically guided lumbar puncture is an option if a standard. So what I'm using instead of standard?
If
Instead
standard
of word
means
standard,
classical.
classical, normal, routine method, common method, classical method, routine method. Okay. So I can use any of these words instead of directly writing standard, because if I use standard, everybody will be able to answer. So if the classical method fails, then we can use fluoroscopically guided lumbar puncture. So I am just rephrasing the same thing and you will, okay. So mention of a test not approved by FDA. Just people try to write the answer in chat, okay. Those who are on Facebook, you can write in the chat Facebook, and those who are on Zoom, you can write on Zoom, okay. And people on Zoom, those who are on Zoom, just try to participate with me actively. That would be better for you if you participate actively, okay? Because you can talk with me, you can give your answers. Dr. Tanzila, you can try this question if you wish. Dr. Tanzila, can you hear me? Dr. Tanzila? No? Okay, Dr. Upol?
Yes, sir.
Okay. So just try to find the answer. Don't tell me you will participate, okay? Just you will tell me how you will do this. So in which text you can guess in which it is possible. People, those who are on Facebook can also guess, okay? Option B. Okay. So let us go for B. Dr. Upol, your question, let me copy the question. So here is your question and here is your text B. Try to find the answer exactly where it can.
TB meningitis.
So let us give a chance to other people. All of you try to find the answer quickly, please, because we don't want to waste a lot of time. quickly find the answer and just fill it as fill in the blank. Okay.
TB meningitis.
TB meningitis.
So try to write in the chat, please, so that other people can also. Yes, on Facebook, Sadia Ahmad, it says option B, option B. Muzammil Sultana says option B. But what if you use add a fill in the blank? What would be the answer if you use as fill in the blank? It's very easy, okay? Let us not waste a lot of time. Dr. Upol, can you explain me how you will be able to find the answer? Quickly, please.
So we can guess it should be in the table.
Yes, in the table
Because
is possible.
yeah.
Yeah.
So in the table, we can scan through the columns.
Yes, in the
Because
columns,
names,
yes.
values are there, the explanation, further CSF testing. So there we can find actually FDA.
FDA is your keyword, okay?
Yeah.
And FDA can be there 2 to 3 times. You need to find a test that is not approved by FDA. So FDA is written here.
Not approved.
So
Yeah.
nucleus test is not approved by FDA, okay? So mention of text approved, not approved by FDA is in text B. But which test? This is not TB meningitis. The test is nucleic acid test. If it is fill in the blank, so it would be nucleic acid test, not TB meningitis. This is the diagnosis. If it is fill in the blank, the answer would be nucleic acid test. But here we just need to write which text, okay, in which text. So text is B. Then let us go to next question. Use of caffeine in increasing production of spinal fluid. Just 1 minute. Okay, so use of caffeine in increasing production of spinal fluid. Let us see what people say on Facebook. In which text is possible? Doctors and nurses on Facebook. In C. So most of people on C, Muzammil Sultana, Miss Jamanti, Shazadi Aftab, Sadia Ahmad. So all of you are saying text C. And people on Zoom are saying C or A. Okay, let's go to text C. This is the question. And this is the text C, okay. So I can show like this. So your question is here. This is your question and this is the text C. Try to find the answer, please, where you can find the answer. So what are your keywords? Just don't try to find the answer haphazardly. So Dr. Nadeem, what would be our method to find the answer?
Sir, we will look for the keywords.
What are the keywords in this question?
increase in the production of spinal fluid.
So no, the main keyword is caffeine.
Caffeine keyword.
Caffeine. Sorry.
Caffeine
Yes.
is the main keyword. Next
Yes, sir.
keyword is in the use of production, increasing production. So now try to find the answer in text C. If you can find or not, just tell me. All of you, just write in the chat. You can find or not. So how many times caffeine is mentioned in this text C? How many times? Try to find the caffeine.
Sir, it is mentioned one time in the prevention, last bullet point.
Mhm.
Or even in the treatment.
In the treatment, okay. Now try to find. Now you are able to find. This is I'm saying. We don't need to rush to do a lot of questions. Just I'm telling I'm just teaching the approach how we approach the questions. Okay, so caffeine is mentioned 2 times here. Okay, here and here. Okay, 2 times. But our question is, you use a caffeine in increasing production of spinal fluid. Here they're talking about treatment of post lumbar puncture headache. Cochrane review has shown caffeine to be helpful in the treatment. Okay, there is no mention of it helps in increasing production of spinal fluid. It says there is no evidence that caffeine reduces the incidence of post lumbar puncture headache. Now my question is your answer text C?
No, sir.
No. People on Facebook, what do you say? People on Facebook, what do you say? It's not in the C. Okay, so then if it is not in the C, where we should go?
Yeah, there is a caffeine can also relieve pain and help promote.
Second paragraph.
Okay, can you hear me?
Yes, sir.
Okay, so Dr. Nadeem, where is the answer? Sorry, I was a little bit
S-
busy with patients, so sometimes I get patients
Sir,
also.
in the second paragraph of managing side effects.
Second paragraph, okay. Caffeine can also relieve pain and help promote CSF production, okay.
Yes, sir.
So if you see, you can use see the instead of promote, I am using increase. So can we use instead of promote increase production of?
Yes, sir.
So
Yes.
this is I'm using synonym. I'm using synonym, okay.
Yes, sir.
Okay, so this is the trick that I wanted to tell you. So caffeine is mentioned in two texts, text A and text C. Yes or no, Dr. Nadeem?
Yes,
Yes,
sir.
sir.
And most
So
of the students choose
most
C.
of the students will go for C. It is not
Yes,
wrong
sir.
to think about C because in C it is possible. But please verify your answer quickly, not don't spend too much time. Go to text C. This is the trick that I want to teach. We are not here to do a lot of questions in one, in 1 hour class. So the tricks that I want to teach you. So the caffeine is mentioned in two texts, text C and text A. So, but in our mind, first comes text C. That is not a problem. Go for text C because headache is the main topic in text C. Go for C and find the caffeine. Okay, find the caffeine and then try to find if it shows that it increases production of spinal fluid. So we have find it on two places, but it is not mentioning about production of CSF fluid. No problem. Leave this text. In B, it is not possible. Go for A because they are also talking about managing side effects. So find caffeine. Caffeine is written here and try to find the answer here. Okay, very quickly. Don't spend too much time. Let's go for next. Okay, quickly. So types of viruses that can lead to meningitis. Where we can find just what comes in your mind. Types of viruses that can lead to meningitis. In which text it is possible? Just quickly, please. People on Facebook, try to answer also because you also need to participate actively. So in which text it is possible? Types of viruses that can lead to meningitis. I can see on Facebook, A, Miss Jivanti says A, Shadi Aftab says A. Okay. What else? Anybody else on Zoom? B, Dr. Manish says B. Okay, Dr. Paul says C. So you don't have any consensus in which text we can find. Okay. Muzammil Sultana says B. So most of you are saying A. Okay, let us go to A. Types of viruses that can lead to meningitis. So where you can find types of viruses? This what is lumbar puncture, the reason, contraindications. Contraindications here, managing the side effects. They're not talking about types of viruses that can lead to meningitis. Is the answer in text A? Yes or no?
No, sir.
No? Okay, so if it is not in A, where we should go now? Anybody else
Sir,
wants to participate? Anybody else wants to participate? Any doctor, any nurse? No? Anybody
sir, in
else?
text B,
Yes, who wants to
I think.
participate?
Sir, Dr. Nadeem,
Yeah, Dr. Nadeem is already participating. Dr. Paul,
Uh,
Dr. Nadeem, and Dr. Manish. Apart from these three,
in the
anybody else
in the
wants to
table,
participate?
look on the
Okay,
table.
Dr. Paul. Okay, so text A, it is not mentioned. Okay, so let us go for text B. Okay, where it is possible, Dr. Paul?
Viral meningitis. Yeah,
What is the
viral
question?
meningitis.
We need to see the question. What is the question? Let us copy the question here. Types of viruses that can lead to meningitis.
Yeah, and further CSF testing.
In C, they are not talking about, they are just talking about post lumbar puncture headache. In D, they are talking about future developments. So here
Is B.
is the B, okay?
Yeah,
But what is the answer? If it is fill in the blank, what you will write?
types of viruses that can lead to.
There are many.
What is the, if it is a
viruses.
fill in the blank,
HSV.
if it is fill in the blank, what you will write?
Enteroviruses. HSV.
Just write all the viruses, okay? Enteroviruses, HSV, VZU, VZV, and arboviruses, okay? Just write all of them. So you can see they have not mentioned like a sentence types of viruses that can lead to meningitis. Just it is a heading here, viral meningitis. In the bracket, they have written the viruses that can lead to viral meningitis. So I am just writing types of viruses that can lead to meningitis. These viruses can lead to meningitis. But now I am asking directly types of viruses. Okay. Not just types of meningitis, no, types of viruses. So it's very easy, but you will spend a little bit time to find the answer. Let us go to next. Use of X-ray and lumbar puncture. Very easy, very easy. Use of X-ray and lumbar puncture. In which text you can find? Dr. Manish, you will try to answer. Use of X-ray and lumbar puncture. In which text you can find the answer?
C.
In C? Okay, very good. Let us go to C. Let us go to C. Yes, it is C here. Can you find the answer here? People on Facebook, you can also participate. Don't worry. I'm just, Miss Jivanti says D, Miss Sadia says D, Miss Muzammil Sultana, maybe Miss our doctor, says D. So on Facebook, most of the people are saying D. Okay, let us go to D, no problem. Dr. Manish, try to find the answer here in D.
Okay, sir.
What are your keywords?
X-ray.
X-ray, okay. Use of X-ray in lumbar puncture.
But due to X-ray exposure, they are not suitable for pregnant. Second paragraph.
Second paragraph, okay. So what is your answer? Text D, okay. So use of X-ray and lumbar puncture is written in text D. So one answer is text D, okay. So next question is aggravating factors for one side effect of lumbar puncture. In which text it is possible? Aggravating factors of one side effect of lumbar puncture. In which text it is possible?
A. Aggravating factors.
Aggravating factors for one side effect of lumbar puncture. for one side effect of lumbar puncture. In which text is possible? So
Please
in
show
which text?
paragraph.
In which? Dr. Sam?
Show paragraph again.
Okay, texts. Okay. This is future developments. This is post lumbar puncture headache. Prevention, treatment. This is table. And here is text A. So in which text is possible? Where you will go first? In which text?
C, sir.
In C? Okay, so let us go for C. The question is, let us copy the question here. Aggravating factors for one side effect of lumbar puncture.
The headache is aggravated by coughing or
Yeah, the headache is aggravated by coughing or straining and can be associated with other factors. Okay. Aggravating factors for one side effect of lumbar puncture. So this is headache is one side effect, and these are the aggravating factors. So your answer is text C. Okay. Good. So now the question number 7, a position after lumbar puncture procedure that can relieve headache. A position after lumbar puncture that can relieve headache. In which text it is possible? In which text it is possible? The question number 7. People on Facebook, try to answer quickly, please. In which text it is possible? Text C. So most of you are saying C. I think so. So we're talking about headache. Okay. Let us go. Text C. Okay. So here is your text C. And here is your question. Try to find the answer, please.
it presents in upright positions in first
Please,
para.
please, 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 please. Try to find. Let other people do also. No, you need to, write it as a fill in the blank. Fill in the blank. Don't just tell where is the answer in which text. Fill in the blank,
Upright position.
please.
Upright position.
Please try to write in the chat your answer. Don't tell me. Write in the chat. And other people, please participate actively. If you are just here to listen, you will not learn a lot. Try to participate, try to write your answer, even if it could be wrong, but try to write your answers. Try to write your answers. So if it is so according to your answers, upright position, okay. So if you go to the text, they are just having a position after number punctuation that can relieve headache. So which text you will write? Text A, B, C, or D? Which text? Because this is not fill in the blank. So if your answer is here, relieve upright position, so you can write C if your answer is here. So in which text you can find the answer of position after number punctuation that can relieve headache? People, please try to focus. So most of you are saying upright position. Now let us go to text A. Try to find here if possible. Okay, so Dr. Manish. Dr. Paul,
Yes, in the
what is your answer?
managing side effects, second paragraph.
This one. This sentence, yes? Try
Yes, sir.
lying down,
Yeah.
since being upright can make the pain worse. So
Yes.
this is the answer. If it was fill in the blank, so what we will write? A position after left position that can relieve pain. Which position? Which position? Lying down. Lying down.
Lying down.
But here we will just write in which text you can find the answer. So believe me, more than 50% of you, more than 50% of you will write this. It presents in upright position. So you will be writing upright position or text C. Most of you, when you are in a hurry, when you are finding answer quickly in the real exam, so most of you will go for text C. This is the trick. Your keywords are position and that relieves headache. Position that relieves headache. If you go here, it presents in the upright position. So what does it mean?
Headache.
It means headache. So headache presents in the upright position. It is not relieved in the upright position, please. So most of you were giving wrong answer, upright position. That was wrong answer. And this is what the examiner is looking for. The examiner is just doing a trick so that most of you will be writing upright position or text C. So please be careful, okay? Be careful. This is just a little bit tricks that can help you to pass or fail your reading exam, because all of you are not doing the same strategies. Okay, so let us move to next question quickly. So no is fill in the blank, okay? It can be a word, numbers, or both, okay? What can help learning doctors to keep their skill of lumbar puncture updated? In which text? Just write in the chat, please. Don't tell me. What can help learning doctors to keep their skills of lumbar puncture updated? In which text it is possible? First, you need to find the text in which it is possible, then try to find the exact answer. So your keywords are learning doctors and okay, and updated skills, their updated skills, okay? The things that can help their skills about lumbar puncture to be updated where it is possible. Where it is possible. And D? Okay. So let me see on Facebook also, because there are a lot of people on Facebook with us also. Sadi Ahmed and Shazadi Aftab say text D, okay? And Muzammil Sultan also says text D. So let us go to text D. No, it is fill in the blank, not just which text. Fill in the blank. No, write in the chat what is the answer. So you have the text, you have the question on your screen, and try to find the answer. So what is the answer? Here you need to fill in the blank. So what is the answer? Let us see on Facebook. So Dr. Upol, what is the answer?
Lumbar puncture mannequins.
Yes, that is the answer. Lumbar puncture mannequins have been shown to useful for skill development. Skill development also means just development of skills, keep their skills updated in training doctors, and could be used for maintaining. Maintain is just maintain whatever your level is, and revalidate is update. Okay, so you can say to update their skills. What can help learning doctors to keep their skills of lumbar puncture updated? So lumbar puncture mannequins can help them for this. Okay? Easy question, but you will spend some time. Due to a high incidence of which disease, lumbar puncture is going to be a common procedure? In which text you can find the answer? In which text you can find the answer? In which text? Just tell me now the text where you will try to find the answer. where you can try. People on Facebook, please. People on Facebook, try to find the answer, please. Means in which text it is possible, just tell me. So most of you are saying text A. Let us go to text A or D, okay? Let us go to A first. Here is text A. And let me copy the question here so that you people. So here is the question, here is the text. What are the keywords, Dr. Nadeem?
Sir, high incidence
High incidence.
and a common procedure.
Yes. Actually, the main, the main key word is disease. Which disease? You need to find a disease.
Yes, sir.
So to high incidence of which disease? So there is some disease, due to high incidence of which disease? Lumbar puncture is going to be a common procedure. So please try to find in text A. If you just tell me if you can find somebody says meningitis. Let us see what people say on Facebook. They say meningitis. I cannot see the texts. A meningitis. Okay. Anybody else? CNS. Okay. Try to find the answer in text A and just tell me if you can find or not. Yes or not? Quickly, please.
Sir, I think it's not here.
Is not here? Then where we should go?
Sir, in text D.
D?
Yes, sir.
Okay. Let us go for D. Here is question. Here is the text. Try to find the answer, please. Just write in the chat. Don't tell me, please. Don't think this question as a medical question. Just think you're doing reading, okay? Just see in the text. Don't think is medically yes or no, okay? Don't think them medically, okay? Just try to match your keywords. You don't need to overthink. Just try to match keywords, okay? Just match the keywords, please, okay? So if you go through the complete text, A, B, C, D, your keywords mostly will match here, okay? The question can be a little bit improved because we're not talking about ultrasound here. Ultrasound guidance will become a routine part of lumbar puncture practice in future, but increasing rates of obesity. So increasing rates of obesity, increasing incidence, high incidence of which disease, lumbar puncture is going to be a common procedure. So obesity, I will accept obesity here. The question can be improved a little bit, but obesity is the answer. So people just, try to find the keywords. You're finding a disease, obesity is a disease. High incidence, increasing rates of this, is going to be means grammatically, it means will be. Is going to be, it will be. I can add something about ultrasound in the question, but overall, the answer would be obesity, okay? So the next question is, so before we go to next question, just give me 1 minute to show you one thing. So we have very, well organized, and I can say this is the one of the best writing courses that we have, VIP hybrid writing course. All the letters, every class is taken by myself. I don't have anybody else who will teach you. That is the good thing. Another thing is all the letters, all the model answers are written by myself. So we will practice a lot. Three referral letters, 3 urgent referrals, 3 discharge letters, 2 letters to non-medical professionals, 1 letter pediatric patient. In 1 letter there are 2 patients. 1 letter GP to GP transfer. In case of nurses is community nurse to community nurse transfer. So course fee is 100 British pound, and mostly I give 30% discount. After discount would be 70 GBP. And for speaking, we have also speaking feedback available. Is almost 5 pounds per letter if you only go for correction. Is very recently 4 nurses from UK, they are friends with each other. Just one of them started taking classes with me, and then she just referred to others, and most of them were weak. They have already taken, most of them, 3 of them have already taken OET exam, and they got like 290, 270, 80 like this. And the big thing was, after taking VIP hybrid course, all of them, there were 4 nurses, all of them got B grade, and maybe one of them is in the class today on Facebook, so I'm not saying anything wrong. So all of them got B grade. 4 nurses, they joined together, VIP hybrid course. So Dr. Humayun is one of the doctors who passed OET with me a long time ago, but still he just comes and gives his comments. Thank you so much, Dr. Humayun, for your encouragement on Facebook. So people, if you join VIP hybrid course for speaking, for writing, and for speaking, we have also feedback available. So you will never repent, okay? For writing, still I don't have any course because it takes a long time. So I'm trying to teach on free classes. Okay, so next is, what is type of meningitis? Okay, sorry. So next question, what is the type of meningitis if fungal wet prep is positive and glucose level is 45? In which text we can find the answer? In which text? It's very easy. Very easy. In which text you can find the answer? So you people can see on Facebook, Jivanti is there, and she is one of the nurses who got B grade, and they were 4 friends. In writing, they got B grade, all of them. So Wasif Hayat, he is also on Facebook with us, and his wife passed. His wife passed recently. Okay, so as I am doctor like most of you, so I don't take a lot of students. I just take a few students, and then I teach them very well. Okay, so your answer would be in text B. Here is your question, and here is your text. Try to find the answer, please. You have 2 minutes to find the answer. Okay, so thank you for your feedback, those who are giving feedback for their success on Facebook, Dr. Wasif Hayat Wazir and Miss Jivanti, because you and your family members and friends passed after taking my class. Okay, so what is the answer here? So some of you are saying fungal meningitis, some of you are saying cryptococcal meningitis. So these are 2 options. It is must that some of you will go for fungal, and some of you will go for meningitis. So what is the technique, what is the strategy that I'm using here? Anybody can tell me just quickly, please? How you will find the answer? Quickly, please. The true poll. The true poll, please, quickly.
Glucose level should be more than 45 milligrams per deciliter.
Okay, so let us find the key. First, the answer is in text B. For this, which type of meningitis? So I am asking type of meningitis. The answer is
Fungal
from
meningitis.
this type. Okay.
Yeah.
Then you have keywords fungal wet prep test and then glucose level. So if you go through, if you skim and scan quickly in the text, you will see fungal wet prep test 2 times, here and here 2 times.
Yeah.
Okay. So now you are not sure. It could be fungal, it could be cryptococcal. So how you will differentiate between these two? Fungal wet prep test could be positive in fungal meningitis or in cryptococcal meningitis.
Can differentiate by the glucose level.
By the glucose level. If I change the same question, like, no, I was just making if I make it as 40, then both are possible. If it is 40, then it is possible. It could be fungal, it could be cryptococcal, okay? But if it is 45, it could not be cryptococcal because for a cryptococcal, it should be less than 40. And for fungal, it should be less than 50. So 45 is less than 50, okay? So the answer is fungal meningitis. Yes or no? Yes or no?
Yes, sir.
Okay. So now let us change the question. If instead of glucose level, if I'd say protein level, no, what is the answer?
Sir, fungal meningitis.
If protein level is 40, then it is fungal meningitis because this is the protein level.
Yes, sir.
If for cryptococcal, it should be more than 45. If it is 40, it could be fungal meningitis. This is how we make the questions when we are writing the samples. This is how we make the questions, okay? So do you want to complete this task tomorrow? The complete or is enough for today? So we can continue tomorrow, okay? Rest of the questions tomorrow. What do you think? Is it enough for today? If any of you wants to join VIP hybrid course for writing or speaking, so you can join, okay? So we have slots available. So thank you so much. If you people are interested, you can text me on WhatsApp. So I will continue tomorrow from question number 13. Okay, thank you so much. Please give your feedback for the class today and try to invite your friends for next class. Thank you so much.